And joining us in the studio for this week's Your Health segment is Dr. Hal Crane, orthopedic surgeon at the University of Maryland, Baltimore, Washington Medical Center. Doctor, thank you for being with us.
Good evening. Thank you.
As we age, we all want to keep everything moving as easily as possible. How much of that is maybe genetics? How much of it is something where prevention would make a difference?
Well, I think prevention makes a difference for everybody. I think our genetics are really a predisposition to problems. It's not an absolute that we're going to have them. And I think that by addressing them, maybe in a stronger way if we have a family history, but for all of us, prevention is important. We have lifestyles that are not always great, and addressing those kinds of things on a daily basis, oftentimes with very, very practical, simple kinds of issues, really make a difference.
Let's dig into that a little bit. I mean, say, let's focus on knees, for example, and maybe you have somebody who loves to run. Is that necessarily the best exercise? Is there a way to take it easy on your knees and still run?
Well, you know, running itself doesn't cause arthritis. It's a misconception. We have studies that clearly show that people who are runners, when you look at them in population size, don't have more arthritis than the general population, unless you have a problem. If you have a problem, the impact activities of running can definitely accelerate it more quickly. So if your knees are normal, and you don't have a family history of problems, I think unless you run in traffic with your eyes closed, you're not likely to have an arthritic problem.
All right, somebody who's developed some problems, what's the first sign of that? I mean, you feel pain or you feel restriction? You
know, the first sign is usually a little bit of stiffness. It may be some discomfort that you didn't anticipate. You know, you wake up in the morning and things hurt, putting on your shoes, taking off your socks, things like that that you maybe didn't feel before. And it's often subtle. And it has a progression, you know, from subtle and intermittent to often to requiring medication to requiring prescription medication, and then ultimately might even require surgery, but that's always the last resort.
What's happening in the joint itself when you start to feel the stiffness? What's stiff?
I think it's important to understand what arthritis really is, because that's what we're talking about. And if a person were to pull a chicken joint apart, that shiny white stuff on the end of the bone, that's called articular cartilage. And the generic term arthritis really means that articular cartilage is starting to break down. And it goes, if you look at it, literally from shiny and smooth to dull to fragmented to cobblestones to potholes. And that's how it progresses. And you know, when it's potholes, it's usually a lot more than stiffness. It's pain, it's deformity, and so forth. But the majority of it is not that. The majority is stiffness, and you take a little Tylenol, you take a little Advil, and it makes a big difference.
Let's grab a phone call. This is John in Baltimore County. John, thank you for calling. Go ahead.
Hello. My question is about the nature of the cells that make up the cartilage. An analogy would be our bone cells. I understand they are constantly being destroyed and then rebuilt. And the pharmaceutical industry has developed I think they're the biophosphate class of drugs that bring this into balance and then retired osteoporosis. I wonder if it's even theoretically possible for the cells of the cartilage to be attacked in that way by pharmaceutical agents. And if any investigation is going on now in that area.
Yeah, good question. Thank you very much for the phone call. Is there anything out there that actually repairs the cartilage?
Currently, there is not. We have some injectable materials that lubricate the cartilage, that soothe the cartilage. It doesn't rebuild the cartilage. Our mainstay of anti-inflammatories reduce the inflammation associated with it. But we don't have yet medication by any form or route of administration that rebuilds those cartilage cells. We're very hopeful with the genetic research that's going on. We really have some opportunities for the future. We are seeing things today that 10 years ago we didn't imagine. And so as that process continues, I'm very hopeful.
What's your experience in your practice with the supplements, the glucosamine and all that? Does it work?
I perhaps am a little bit different from some of my colleagues. I think if it's known not to be harmful, whether or not there are studies that show that it works, try it. Because there are plenty of people who get improvement from it, even though things aren't supposed to work. You just want to measure what's the risk of doing it. I think the studies today suggest that glucosamine and the things like that may not meet the standards of scientific proof that other drugs do, but I have a lot of people who tell me it helps them.
Let's talk to Larry in WICOMICO County. Larry, thanks for the call. Go ahead.
Hi.
Hi.
I do quite a bit of walking during the day, at least a couple miles, and it's on soft ground. And a couple times a year I go abroad and on trips where we do a lot of walking, mostly on hard ground, hard concrete. And after only a day or two when we go abroad, my feet get very, very sore. And they seem to heal overnight in that in the morning they feel pretty good again, but by midday they're hurting real bad again.
So it's your feet, it's not your shins, your knees?
It's my feet.
Okay. Thanks very much.
Thank you.
Thoughts?
Walking is a phenomenal exercise, and for people who don't have advanced arthritis, it's one of the more friendly things. But as we get older, we get structural problems with our feet. Our feet are a little bit like the tread on our tires, and the more you use them, the more wear they get. And I think if it happens only when you travel, and it's not happening here, it might be related to your shoes, because when we travel, we're on airplanes, our feet swell a little bit, our shoes fit a little bit differently. I think I would look into that sort of thing, but make sure that you're wearing shoes that have as much cushion and as much support as is practical. I mean, you're not going to wear those shoes on the beach, but for sure, for walking, it's a good thing.
Let's go to Anne Arundel County. This is Wayne. Wayne, go ahead.
Good afternoon, or good evening.
Good evening.
I just had an x-ray for hip pain, and it showed I have osteonecrosis. I'm just wondering what the best course of action is. Medications have not seemed to work, and the hip also feels very weak.
Yeah, Wayne, we'll get you an answer. Good luck there.
Thank you.
Well, osteonecrosis is a condition for a variety of reasons. The blood supply to the hip ball or the femoral head has been interrupted, and so the ball dies, and it follows a path of decline and eventually collapses and causes arthritis and significant pain. If there is already collapse, then the surgical procedures that we have that are sometimes helpful in arresting the disease are not very effective. And now it's a matter of managing your activities, cushioning the joint, supportive things, medications like anti-inflammatories, non-narcotic pain medications. When you get to the point that you're requiring narcotic pain medicine or nearly there, or the pain so much affects your daily activities, that's when the role of surgery comes into play.
What's your surgical practice like? What do you do most of?
I do mostly hip and knee replacement surgeries and redo hip and knee replacement surgeries. So somebody has had a joint replacement that is either worn out or it is not working the way that they had hoped that it would.
So what's the lifespan if somebody gets their knees or hip done? How long is it supposed to last for?
Well, you know, our materials have improved quite a lot. There was sort of a given that was never true, that hip and knee replacements lasted 10 years. They always lasted, in the majority of people, much longer than that. And today, with the materials that we have, 15 to 20 years out from surgery, over 90% of people are still working, functioning perfectly.
And in a few seconds, how does somebody know that it's time to go to surgery?
Surgery is always the last resort. Sometimes patients will go to doctors and they'll come away with the notion, he told me I have nothing else to do, I need to have this surgery. But it really is the way the doctor is expressing the fact that I've got nothing else to offer.
So you can live with this, or
you can live with it.
It's
not like cancer, you know. And if a person is middle-aged and they have a tolerable amount of pain, they should probably live with it until it impacts their quality of life, and that means a variety of things.
Very good. Dr. Hal Crane is with the University of Maryland's Baltimore Washington Medical Center. Doctor, thanks for the time.
Thank you for having me.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.